Good afternoon, everyone. Welcome to the Directors Organizational Meeting for the Lincoln City Council for Monday, March 22nd, 2021. Madam Clerk, do we have any adjustments to the agenda? Seeing none, Madam Clerk?
On our City Council agenda for Monday, March 22nd, items 1A through 1D will be introduced by Raybold. And then our section 4 under public hearing liquor resolutions, ask permission to call items 4A and 4B together. Items 4D and 4E together. It is the same manager applicant, Hannah L. McMahon, but for two different locations. And for section 6, under public hearing ordinances, second reading and related resolutions, I'll be calling items 6A and 6B together. And asking for permission to also call items 6C and 6D together.
You said 6D is in dog and E?
Nope, C as in Charlie, D as in David.
Okay.
And back to our public hearing resolutions, just for item 5A, we will have a sign here sheet for that item. And I will be calling the names of those that are coming forward to testify as they sign in.
Okay. Anybody else have any questions?
I have a question, Roy. On 4D and E, it had said that, and I just want to have this conversation. It said that she had been manager for both locations.
Right.
For the same amount of time, but the application and when looked at closely, did not,
Is not the same amount of time.
right. Okay,
Yeah. I don't know what that means.
okay. I may ask
May I ask? Yes.
Investigator Parker when he arrives. Okay, thank you.
Anything else?
Jane
Okay.
has something.
Yes. Councilperson Raybold.
I know that there is a motion to amend number 1 to item 21R-82. Is someone going to introduce that?
Where are you?
It's a motion to amend number 1.
Okay.
This is on the climate action plan. This was,
I'd like to introduce that.
I don't have it. It might be on the, no, it's probably on the.
it should be right on your desk.
I left a copy on your desk.
Okay.
Let me see. I think I have an extra one, Councilwoman Washington.
Oh, sorry. Paper stuck together. You're better than I am. Okay.
I would be
Right.
happy to introduce it if no one else wants to do that.
Okay.
Yeah,
We'll
yeah,
have
we looked at
Jane,
these.
yeah, I'll review some of these later.
Yeah,
Okay.
I returned these. Some of them, yes, are, and some of them are not. They're from, the comments are consolidated from 3 different places.
Right. Okay. Any other comments for the agenda? Madam Clerk?
Nope, that's all I have.
Okay. Okay, sounds good. Let's move on. If the mayor's office has anything to say at this point? Okay, so if we can wait here for a second for Pat to come down. Any boards, committee, commission reports anybody would like to speak about? We have a DLA meeting tomorrow morning. Okay. We've had a couple of requests. I don't know if you've seen those by LTU for presentations, pre-council presentations. One was on the scooters,
Yeah.
just a report on the scooters and what they know at this point. The other one was the downtown transportation plan.
Okay.
And I haven't seen either at this point, but I suggested to her if she can put it in writing or give us a report in writing, and then we can decide if we want a full pre-council meeting
Mhm.
prior to that, in the next few weeks. We may wait and just see what the report says and then decide if we want a full council meeting to ask all the questions.
Is the downtown transportation plan the bus depot?
No, I believe it's more 13th Street, one ways. It's about turning a lot of streets downtown into two ways. So,
Fascinating conversation.
But let's wait until they at least release the plan, then we can have a discussion about it. And she said that might be later in April anyway. Okay. Is there anything else anybody would like to talk about on any of the other boards or committees that they're on? Yes,
Is there someone from LTU here today?
I didn't see yet.
Is Lynn Johnson here too?
Yeah, who would you like to talk? You would like to,
Either Lynn Johnson or LTU. It deals with the lack of communication between the two of them when it comes to our tree management.
okay. Yes,
I have a piece of happy thing to talk about. The one beneficial thing that came out of this last year is we've had more golf rounds played than years and years. The golf program is booming. There you
Yeah.
go.
And also, our trail system has never been so loved and appreciated than ever before. I can attest that I have to ride my bike a lot earlier if I want to avoid families with small children and just so many people out enjoying our amazing trail network. And it's spectacular to see so many people out really appreciating them and exploring them. So that's another wonderful thing that has happened.
Yeah, it's good. I mean, even the parks are getting, like,
Oh.
they're at 180% up. I mean, it's just, we're all going outdoors.
I
And-
I visit Holmes Lake every day, and it's just amazing that the amount of traffic that park gets. Well, I go looking for coyotes, I admit. Try to find their dens. So I think Director Lopez is in the building. We're ready. Got caught in the rain, huh? Thank you for coming down, though. Really appreciate it. Your reports are great for us. Very informative.
Thank you. I can't run up the steps as well as I used to. Today, we're at 29,148 cases. And we had 37 additional cases yesterday. I have to take off my mask. And so our total number of cases reported last week ending March 20th was 327, which is similar to the week of March 13th. So we're kind of pretty flat in going forward. They're meeting on the risk dial, and I'll know those results here soon. We'll have a discussion. So we've seen a decline of 64% of cases month over month in the last 3 months. So last week we adopted a new way of calculating our positivity rate. I mean, that's different. It's not a new positivity rate. It's using the test over test method. And that's similar to what's used by CDC and the state. And it provides a really accurate look at where we're at with positivity. So since we've been relatively flat in the last 4 weeks, we're averaging around 7% positivity now. And if, you'll see too on our charts that we've also included the UNL saliva testing. And they're doing about 3,000 tests a week. And their positivity rate's really low. And the other thing that's really been happening that is encouraging is to date in March, we've had 3 deaths, which is really encouraging Our highest number of deaths was 74 in December, so seeing where we are in March is encouraging. Our hospital rates are going down. We have 17 individuals hospitalized right now, and 13 are from Lancaster County, and 7 are, that's not right, we have 20 people hospitalized. So 7 are from out of county. As of yesterday, we've administered 136,038 doses of vaccine to Lancaster County residents. And of those doses, 89,357 received their first dose, and 46,681 received their second doses. So either Moderna or Pfizer vaccine. And in all, 50,733 individuals in our community are completely vaccinated now. And you'll see tomorrow, probably on the dashboard, we're going to have a new page that shows by age group what the percentage of those is that are vaccinated. But when you look at it, remember, we're still going to do our individuals living in the home and in congregate living. We're just waiting for some more Johnson & Johnson vaccine for that. But we had several large clinics last week. As I was telling you, we did a smaller clinic for about 3,000 individuals at Pinnacle Bank that were age 71 and over. That was second doses. And we did 8,000 doses on Friday and Saturday for 65 and older. And we're moving down lower, 60 and under now. So this week we'll only be doing 5,000 doses, just regulating for where we have our second doses since we've been doing such large first dose clinics. Hopefully we'll get more vaccine. We're told we should have more vaccine for Johnson & Johnson perhaps this week.
Good. Good news. Any questions? Yes, Councilperson Washington.
Director Lopez, can you tell us, do you know the percentage of teachers? I mean, are we halfway through the teachers? Are we?
We did the last call for teachers last week. So we've offered it 3 times now. And we'll finish the higher ed offer. And so we're hoping that it's been offered to everyone to get a dose that might want a dose. We're actually moving into doing second doses for the teachers. Isn't that surprising already?
Councilperson Rabel.
Well, Director Lopez, I can tell you, I witnessed firsthand last week the incredible organization work that has been done by the City of Lincoln, Lancaster County Health Department. And I just want to say a big thank you because the grocery workers were vaccinated for the first time. And I can tell you there was huge excitement in all the stores, all grocery workers in Lincoln and Lancaster County Health Department. It almost paralleled Christmas, how excited people get about the Christmas season. And it was just extraordinarily well organized, and people were beyond excited. And all the volunteers couldn't have been nicer and just more enthusiastic about making sure as many people got vaccinated as possible. It was such a joyous experience to be there. So thank you. Thank you for you and your team for the amazing work that you're doing. It's really exciting to see so many people in Lincoln get vaccinated. So thank you.
And thank you. We have a great team of people and volunteers working. It takes a lot to get even just running everything from getting people parked and out. And we're really grateful for the assistance of Lincoln Police and Lincoln Fire. They provide a lot of assistance to us in the clinics. So.
Yes, Councilperson Christensen.
So I've learned through life that there's an 80-20 rule. You spend 80% of your energy getting the last 20% of the job done, quite often. What is the plan for getting to those people who just can't come to the arena, that are homebound all over the city?
We've been actually working with Tabitha, assisted us in coordinating with all the home health agencies and private institutions. We've also reached out to several of the organizations in the community that interact, and through Aging Partners. And so we actually have over 1,200 individuals registered that Tabitha will be providing the vaccine in home as soon as we receive some Johnson & Johnson. And we've gotten the word out. There are some individuals that might not be using any services, but have a family member or that. So we've been getting people contacting us also that
Great.
way too. And they document it in the registration, and so we're able to pull those out and get them referred.
So you're kind of reserving the Johnson & Johnson for
Yes.
these people, so you can make one trip to them instead of two?
Right, and make it easier on them, and also make sure that their family member caregiver is also vaccinated. And we'll also be doing our folks that are living in homeless shelters and who are currently residing in the corrections facility that way.
Any other questions? Thank you, Director Lopez,
I have
yes.
one more. Pat, could you tell people again the website that they can go to in case they have not registered in Lincoln, Lancaster County?
Actually, if you just go to the city webpage and click right on the top, it'll take you directly to the registration. It says the COVID registration right on the top.
And so if someone in like an age group of 71 and older did not get notified about that, what is the number at the health department that they can call? Or should they just call their physician and the physician coordinates?
No, they should just call us, and they can call 402-441-8006.
8006, okay,
And we'll
great.
help them get registered. I can
Okay.
send that link to you both.
That's great, thank you so much.
And we're encouraging them to do that. Right now, I've been focusing on the 50. If you're over 50 or older, please make sure you're registered so we can reach you.
Okay, any other questions for Pat? Thank you for coming down. Thank you for hustling up the stairs.
Need to do that more.
Can pay a lot of money and go to a stair stepper. Any other comments or questions for today? Anybody else would like to come forward and speak on anything at this point? Okay. Seeing none, we stand adjourned until 3 o'clock.